News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. If you're interested in learning about new therapies and how they're helping people deal with problems and challenges and difficulties in their life, you'll want to watch our show today. Many therapies like acceptance and commitment therapy are effective, but they are not reaching as many people as they could. Our guest today, Dr. Jonathan Bricker, will talk with us about what he is doing to help people overcome obstacles to learning skills for better living. Our guest, Dr. Jonathan Bricker, is an assistant professor at the University of Washington and Fred Hutchinson Cancer Research Center and clinical psychologist in part-time practice. He conducts research on innovative counseling approaches for changing health behavior at the public health level. Jonathan, thank you so much for coming here to talk with us today.
Well, thank you for having me, Tom.
Yeah.
It's a pleasure to be here.
Yeah, it's really great. So with the big debate that's going on in Congress about health care and how health care is going to develop, how do you see this impacting the world of acceptance and commitment therapy and psychology in general, Jonathan?
Well, I think the big impact and the big issue that really needs to be debated more in Congress and as we create this reform bill is access to cutting-edge therapies like acceptance and commitment therapy. Because the sad fact is only about, for example, 10 to 30% of people with depression seek any kind of counseling, much less the cutting-edge therapies like ACT. And that's really unfortunate, and that's really sad. So I think part of the debate it would be really important if they focused on how is it that we can be able to get emerging therapies and therapies that are proven to be effective out to the public so that people can make use of them.
Yes, so there's a low percentage of people struggling with depression who get counseling support, and then I guess the figure for people stopping smoking is even less than that.
Actually, it's dismally low. It's 1%.
1%.
1% of people who are trying to quit smoking actually get any kind of counseling. And that's not including the counseling. I mean, within that 1% is counseling that is proven to be effective. I'm just talking about any kind of counseling, 1%.
So people with depression or wanting to stop smoking or change other behaviors, they're really not getting the support that could be helpful to them in being successful and developing new lifestyle behaviors, huh?
That's correct. Yeah. That's correct.
What can you say about why people are not getting counseling?
Well, I think there are three key reasons. I think one is cost. You know, therapy is expensive. Therapy, a lot of people who have insurance have very limited coverage for therapy. And, you know, let's take an example of someone. Let's say someone is a waiter, and say this person is working 2 jobs. And for that person to be able to get therapy, he would basically need to have that covered by his or her employer's health care plan. And then if that's not the case, then this person would have a very difficult choice between paying the rent or paying for therapy. So cost is a huge one. The second one is the time. You know, most therapies are typically 12 to 15 sessions on average. So this individual would need to leave work, drive to a therapist's office, and be able to do that Monday through Friday between 9 and 6 p.m. when most therapists work. That's pretty difficult if you're working 2 jobs.
Yes, sure.
And so time is a huge challenge. And if that person lived in a rural area, boy, they have an even more difficult commute.
Yes.
And then the third key issue is stigma. I think that a lot of the reason why people aren't seeking out care is because they feel very stigmatized, not only about behavioral problems, but about getting help for those problems. And men, minorities, people under 30, people over 60, these are the folks that tend to not seek out therapy. And I think stigma is an enormous burden that these individuals carry.
So the 3 issues then are cost, time, and stigma.
Yes.
So can you tell us a little bit then about how are you addressing these or finessing these to help people get help who seem to have been blocked from getting help previously?
Yes. Well, in order to reach those individuals, the work that I'm leading with my colleagues at the University of Washington is focusing on being able to deliver these interventions on a public health level, that is looking at the whole community at a very broad scale. And in particular, what we're doing now is we're developing ACT as a telephone therapy, in particular to help people quit smoking. But of course, this can be expanded to help people change many other behavioral issues. Our particular focus of our research is on telephone therapy. And we believe that that can help address these key barriers of expense, time, and stigma.
Yeah. And have you found so far that, in fact, people are accessing help who maybe had been blocked before?
Absolutely. For example, we have a study that we just completed where the sample was, majority of the individuals, 60% of the sample was minority, 64% of the sample met the definition of U.S. federal poverty level. And these are individuals who typically do not seek out counseling. So we made a point of sampling and making sure that we could include these individuals within our study so that we could be able to reach them and to see how helpful and effective this therapy could be. And we were very encouraged by our findings.
Oh yeah, that is really encouraging to hear this number of people who previously maybe could not access counseling, they are getting access to help. And this is specifically for stopping smoking at this time.
Right, for as a start, because the model that we're adopting as we're testing ACT is we're modeling a program that's available actually in the state of Nevada and in all 50 states, and that's the quit lines.
Okay, so we want to hear more from Jonathan about the quit lines and more about acceptance and commitment therapy and phone therapy in particular right after this brief break. Hello and welcome back to New Skills for Living. Our guest is Dr. Jonathan Bricker from the University of Washington. So, Jonathan, we were just talking about how the system is really not serving people and stigma has traditionally gotten in the way of people getting help. Can you tell us more about what you're doing to fix this problem?
Yes, well, as I was alluding to earlier, we have developed the first telephone therapy of acceptance and commitment therapy. And we tested it specifically for smoking cessation, and in particular because the telephone is actually one of the ways in which people can get quit counseling for smoking cessation all throughout the 50 states. So it served as a good model for us to begin to test this work and really to simply take a new type of behavioral counseling into this model and infrastructure that's already in place in every state in the United States. If you dial 1-800-QUIT NOW, you will be tied into your state's quit line and be able to receive behavioral counseling and some kind of pharmacotherapy assistance, typically the nicotine patch. The way it's done now is in the traditional approach to therapy, the traditional cognitive behavioral skills training. But what we're doing is we're testing ACT therapy as a telephone intervention. And as we can talk about later, the actual way in which that works is different. The study we did was very promising. We were able to show in this study a doubling of the quit rate using ACT as compared to the standard approach. So we had 29% of the individuals having quit smoking and staying quit for 12 months after the end of treatment.
Well,
not a puff. Not one person relapsed. And that's compared to the average state quit lines achieve about 12 or 13% with just behavioral counseling. And so we're very encouraged by these findings, and we're going to be taking the next steps of research with them. And so that's a way in which we were testing the feasibility and getting some initial outcome data, which will lead us to doing further research.
Yeah,
so
that is very exciting. Those are some great results.
Yeah, we're very encouraged by those results.
Yeah.
And the fact that we were able to achieve them in a population that was primarily minority and 64% at or below the poverty level, these are the folks who are being left out by the traditional face-to-face approach that you and I do in our practices. I mean, I do this myself in my private practice, a face-to-face approach, but I also recognize that there are people who are being left out by this approach, and I think the telephone is a great example of being able to reach those individuals.
Yeah. So as an effective intervention, this is a real nice ripple effect, and from the perspective of public health, I mean, this is really powerful and dynamic, it sounds to me, in terms of touching people's lives in such a positive way.
Absolutely. Being able to reach people who are not otherwise reached by therapy. And I think that can help address the issue of stigma by making it more convenient and accessible. People can call a quit line from the privacy of their own home. They can be able to get it in a cost-effective way. Quit line counseling, it costs about $350 to deliver, as opposed to about $1,200 to $1,500 for an individual face-to-face therapy, if you're averaging about 12 to 15 sessions in a typical format. And telephone therapy is covered either by Medicare or it's covered by one's own insurance fully in most states and most healthcare plans. And in some states, if you don't have any insurance, it's free. And so the cost of delivery for the quit line is about $350. But that doesn't mean that the individual who's calling actually has to pay $350.
I see.
And so there's a great cost savings advantage. And there is some loss of the effect. It's not quite as effective as regular face-to-face counseling, but when you're able to deliver something on such a broad scale and you're losing a small but significant amount of the effect, you can still be able to make a huge impact at the population level.
Oh, yeah.
And when you look at the world from that perspective, this holds really great promise and
yeah, it sure
can be
does.
very helpful to people.
It sure does. This is some really good news, and of course we want to explore this further with Dr. Bricker right after this brief break. For Living, we're talking with Dr. Jonathan Bricker. So Jonathan, you gave us the example earlier of the waiter who's working 2 jobs, and let's say this waiter calls you up and says he wants help quitting smoking. How would you respond to him?
Well, the way I would help this gentleman would be really in this using a model that all the previous guests on your show have talked about ACT use. So, you know, really what I'm doing really isn't anything different from what people who've watched prior episodes of your show would see. And really they've kind of laid out the basic model, and whether you're trying to help someone quit smoking, trying to help someone with chronic pain, or trying to help someone with depression or what have you, or obesity, the beauty of the ACT model is it's a very broad model that's very flexible, and so it can be applied to multiple different problem areas.
Yes.
So what I would do with this gentleman would be really essentially applying this model. The only thing that I would be doing that's any different from what the experts before me have talked about on the show is just in the way that I would present ACT on the telephone for smoking cessation. And that's all that would really be really different for this.
So using the basic principles over the telephone with the waiter, and of course he's accessing health care now that maybe he might have been denied previously. Could you kind of run through what this looks like using the ACT model?
Yes, absolutely. Okay. So one of the things that's very common in most quit lines, you get about 5 telephone counseling sessions. The first session is about 30 minutes and the remaining sessions are about 15 minutes. So we have a short time to be on a journey together. And so a way to get across the counseling relationship, which is one important part of the ACT therapy, is I present someone on the telephone. I say, I'd like you to just imagine that the work we're doing together is like taking a journey. Taking a journey in a car, and you are the driver, and I am the navigator up in the front seat with you. And together, we're going to travel places that are really, really important to you. And maybe for you, quitting smoking is about being able to see your children grow up or your grandchildren grow up and graduate from high school. And so we're going to make the journey that we're taking together going to be about that. And so quitting smoking is going to be in the service of that. And in the back seat, like baggage, are the urges you might feel to smoke, or the self-criticism and negative self-talk and self-judgment that you might have about whether you can succeed at quitting. Those are going to be your bags in the back seat. And what I'm going to be doing as your counselor in this journey that we're taking together is I'm going to be showing you some tools on how to make more room in your back seat, so that together we can travel places that are really, really important to you, and that you're not being distracted by the passengers in your back seat or the baggage in your back seat, and instead really focusing on helping you move in directions that really, really matter to you. And so it's just a metaphor. It's really the central metaphor that frames the whole work that we're doing together. And I refer to that at each of the sessions on the telephone. We kind of refer back as a way to help them remember and kind of anchor what we're doing, is saying, oh, we're looking at the baggage now, or we're helping you figure out what direction you're going to take this. And looks like we went off course a little bit. How can we help you get back on the road? And so that metaphor is a key way we frame the journey we're taking together at the beginning.
Yeah, and it sounds like very much it's very empowering therapy. The client is driving the car. It's the client's values that they state and that they want to pursue. And you're the navigator, and you're supporting and encouraging them with living their life to the fullest, not like they're matching up to any values that you or goals that you might have for them.
Absolutely. I make it really clear to them that this is really their journey, and I'm really the navigator helping them get to where they want to go. And so metaphors in ACT can, especially on the phone, because we just have a short amount of time, we're not sitting there in person, metaphors in ACT can be a very vivid way for people to get a real quick sense of what is this program about. How can it be helpful to me? And we try to use metaphors that are very vivid and accessible to people.
And we want to hear more about using ACT over the phone with clients wanting to stop smoking right after this brief break. Hello, and welcome back to New Skills for Living. We're talking with Dr. Jonathan Bricker from the University of Washington. And Jonathan, could you go ahead and expand on this a little bit further, maybe show us how you might talk with a client over the phone about stopping smoking?
Absolutely. So one exercise I could show you, Tom, is an exercise that I do a little bit later in the telephone counseling, after someone has gotten some experience doing the ACT exercises, because this particular exercise does involve a little bit more of commitment, and it can be a little bit more tricky for people to do. But the exercise involves holding an unlit cigarette. And this is actually exactly as I would do it on the phone. I actually have an unlit cigarette, and I would actually have this in my hand while I'm talking on the phone. Usually I have a hands-free handset. And what I would do is, as I'm holding the unlit cigarette, I'd ask the person to get out an unlit cigarette of their own. And if they don't have one, they can use a pen or whatever as a stand-in. And the purpose of this is I just say to them, you know, would you be willing to just try something with me? And if you want to talk about what it meant afterwards, we can do that. We'll just kind of dive in. Would you be open to that? And people are usually open to just trying it, and say, just hold it between your fingers and just notice first just what it's like to have the cigarette between your fingers. And just feel how hard the cigarette is. Notice the length of the cigarette. Notice the texture of the cigarette and the color. And if you're willing, just kind of bring it up near your nose and just kind of smell the tobacco and just kind of notice that. And usually it's about right here. I just have them notice, you know, what is that smelling, what does that bring up for you? And they often say, like, well, I feel like smoking it. And I joke with them. I say, well, if you end up smoking it, you know, or if I end up smoking it, you know, we'll promise we'll tell each other, because I can't see you on the other end. And if you do, you just let me know. But I have them just kind of smell it. If they notice something, I say, okay, now just take a moment. And I close my eyes with them on the phone. I just kind of close your eyes. Just kind of notice, where in your body are you feeling that? And I try to help them hone in. And sometimes it's their chest or their stomach or their mouth. I say, okay, and I'm going to just go silent for just a moment, just allow you to focus on that part of your body and just kind of feel the urge that's there. And then we're just quiet on the phone. And usually I'm quiet on the phone for about 20, 30 seconds. I don't say anything. And let them notice. And then I say to them afterwards, I say, what if it could be like that? You know, what if when you have an urge that you could practice every day, at least once a day, and you bring out and make one of the times you have that cigarette, instead of lighting up the cigarette, to hold the cigarette and to just notice inside you the urges that are there. And see if you can kind of just ride with that for a little bit. And this is a key skill, because what it's designed to do is it's designed to help break the link between the urge and acting on the urge by smoking, and help them see that they can have this urge without necessarily acting on it.
And as you go through that example, what I'm seeing, Jonathan, is you're actually asking them to be with the cigarette and their experience of what's going on with them, rather than attempting to avoid it or control it.
Absolutely.
To just be with it.
Absolutely.
Can you talk a little bit more about that?
Absolutely. I mean, really what I'm helping them do is to kind of slow down the whole process. Because when someone is a smoker, they're doing this every day. They're often not thinking about it. It's a habit. I'm helping kind of just like slow down the tape so that they begin to see that there's something inside them that's triggered. And that's pretty intense, and that is it's the addiction to nicotine that's bringing on a very powerful urge, because the body is dependent on that. And to help them slow down and become aware of that and realize that they don't necessarily have to act on that, and to help them see that this is an urge, it's a state, and it can change. And if they could just observe that change, they'd be able to see that they can have the urge and not necessarily act on the urge. And for some folks, that can be intense, and so having them do it in a different environment where they don't have to smoke is helpful.
Yeah. Well, that was really, really great of you to show us how, in fact, you would interact with a client on the phone. It's been really nice to have Dr. Bricker here with us from the University of Washington. We ask you to be with us again next month as we continue on with our series of taking a look at acceptance and commitment therapy and how that can make a difference in people's lives in so many ways. Next month, we'll be taking a look at OCD and how